It is a national poll conducted by Morning Consult in which 30,000 adults were asked about vaccine hesitancy. For those between the ages of 18 to 34, nearly half say that they're not sure if they'll get vaccinated. Gaby Galvin is the author of the article published in Morning Consult. What were the reasons, Gaby, that people are giving about their hesitancy or their flat-out unwillingness to get vaccinated?
Yeah, hi Betsy. Thanks so much for having me. Happy to be here. You're absolutely right. We took this huge survey. Folks who are in that 18 to 34 range are expressing uncertainty around vaccines or saying that they're not going to get vaccinated at higher rates than people who are a little bit older. What we did find is that most people across groups do want to be vaccinated, but when we just ask those people who say that they're still on the fence about whether or not they want to get a shot, we saw that 36% said that they're concerned about potential side effects tied to the vaccine, and then another 29% are worried about the speed that the vaccines move through clinical trials. Those levels were pretty consistent across all of those groups. Everybody, for the most part, who said that they weren't sold on the vaccine, those were their number 1 and 2 reasons.
I know that breaking down some of the demographics among those who were polled, various groups, whether it was political, racial, or whatever, did you find that the politics of this came into play with more of a government mistrust? Was that a large factor for some of those who were asked?
So it's a great question, and our poll didn't specifically ask about trust in government, but the theme of trust certainly came up. We had another 9% of folks who are not sure about getting vaccinated who said that the reason that they're not sure is because they don't trust the companies that made the vaccines. So trust certainly comes into play. And then we also did see people's political views did relate to whether or not they said that they were eager to get vaccinated. Democrats are more likely to have said that they have either already gotten a vaccine or that they plan to get one. And then we saw a greater share of Republicans who said that they're either not sure or they don't plan to get vaccinated. So there is definitely a partisan split there.
Address the racial inequities that you found in the polling data.
Yes. So what we saw was higher levels of vaccine uncertainty and unwillingness among Black adults and among Hispanic adults compared to white adults. And then we also found pretty stark gaps in terms of access to shots. So when we looked only at folks who said that they definitely want to get vaccinated, we found that white adults were much more likely than either Black adults or Hispanic adults to have actually gotten a shot. So those numbers were 77% for white adults compared with 60% of Black adults and 55% of Hispanic adults.
Awesome. Gaby, this is a good place to take a break. I need to leave you for just 2 minutes, and on the other side of this, I want to bring out one of the points that you specifically wrote about putting the burden on individual people rather than institutions. If you can just hang with me a couple of minutes, we'll be back and talk about that. Again, I'm speaking with Gaby Galvin, the author of an article that was published in Morning Consult late last week using polling numbers or polling results from 30,000 Americans who were asked about vaccine hesitancy. And Gaby, you wrote citing Otis Rowley, a senior vice president at the Rockefeller Foundation's U.S. Equity and Economic Opportunity Initiative, saying that the emphasis on the vaccine hesitancy puts a burden on individual people rather than on the institutions that should be providing information about shots. Explain more about what specifically that means, because there's so much finger pointing and shaming that's rampant on social media with this.
Yeah, absolutely. So I spoke with Otis about the relationship between vaccine hesitancy and access. And his point, which I'm happy to expand on, was that it's important to understand why why vaccination rates are lower in some areas and among certain groups, so that local officials can dig in and say, and look at how to address barriers for people who do want to get vaccinated but are having a hard time getting a shot, whether that's trouble with transportation or signing up online. And then on the flip side, considering folks who aren't sure about getting vaccinated, making sure that they can address questions, help people get whatever information they need to make that decision for themselves and for their families. So Otis is telling me that, you know, his organization is approaching the issue with the framing of that access to shots and access to information about the shots should go hand in hand.
There was a lot that went into the line of questioning just to get a feel for where Americans are when it comes to the vaccine. Were there any surprises in the data that came out from this? Surprises, I guess, according to you?
Sure. So what I found most interesting from our data was the geographic variation. So, you know, as you know, at this point, more than half of adults across the country have gotten at least their first dose of a COVID vaccine. And as the rollout continues, we're expecting supply to begin outstripping demand in some places. And our data shows where that's already starting to happen. And where demand for vaccines might start to wane a bit more. And that carries implications going forward about, where vaccines could be sent, where folks are still waiting for their turn, where public health officials might take a closer look. So we think it's important data to track across the states, and we're going to continue to measure that.
Gaby, I can appreciate where you're coming from. It's a very analytical side to this debate. You're looking at numbers, analyzing the data, but you also personally, you look at the various media articles that are out there or see what's people maybe post on social media. I don't know how much you follow, but it is an emotional debate as well. And getting these numbers out there gives us what kind of picture, in your personal opinion?
Sure. I think it helps us understand where folks are coming from who aren't sure about getting vaccinated. I think it's important to try to understand what people's concerns are and what information might be helpful for them as they think about their decisions around vaccination. I've got family members who aren't totally sure, so I understand, where people are coming from. But to me, it's all about gathering the data on what people are thinking and how they're responding to the vaccine rollout and to the messages that are out there. And that's what we are trying to track.
I love it. Gaby, I can't agree with you more on this, because no matter who I interview on this, I'm going to hear from upset people on the other side if they believe that I'm siding with or whatever when it comes to data, numbers, and the results of even this poll. The facts are still the facts, and I appreciate you being able to kind of break this down and talk to me about it.